This segment of Delmarva Life is brought to you by Tidal Health.
You know, long-term health is a goal for just about everyone. Regular checkups, maintaining a nutritious diet along with exercise. Well, these are some of the things we can do to keep us on the right track. Now, when it comes to our behavioral health, well, things can be a little trickier.
Yeah, if we experience a physical emergency, we know the number to call and the medical staff will be there as soon as humanly possible. But what do we do when we have a behavioral health crisis?
Luckily, Tidal Health has invested the necessary resources to provide an outlet for this very situation. And here to tell us more is Stacy Walker. She is the clinical manager of crisis services with Tidal Health. Stacy, it's good to see you today. Thanks for being here. All right. Well, first of all, let's start off with what is the Tidal Health Crisis Center?
So the Tidal Health Crisis Center is a center that we designed to meet the community needs of patients who are in their perceived psychiatric crisis, who don't have an outpatient provider or can't get in with their outpatient provider. They can come to the crisis center, walk in anytime, Monday through Friday, 8 a.m. to 8 p.m., see a behavioral health clinician. We can provide brief counseling, do a behavioral health assessment to link to a community resource, and if needed, we do have a medication prescriber on site who can prescribe some psychiatric medications until we can get them into a permanent provider.
So how has the impact been so far on the community?
Oh, it's been wonderful.
Yeah.
You know, the community has really rallied around us and sent patients our way. Because right when we opened, we had an outpatient service close. So it kind of went hand in hand. We were able to get patients seen and keep them stable on their medications.
So to go there, do you need a referral from your doctor or anything like that?
Absolutely not. You can walk in anytime. However, you know, anyone can refer as well. You know, some patients will go to their primary care and say, you know, I'm having anxiety. I don't know where to go. So the doctors can say, hey, the crisis center is here. Walk on in. They'll give us a call, say, hey, I'm sending over Sally. This is what's going on. And boom, Sally's in and we're giving her the services that she needs.
So help us understand the term behavioral crisis. What does that mean?
Well, that would depend on the patient. Everybody perceives their own crisis differently. So it could be they're experiencing a loss. They just had a loss of a family member.
Yeah.
It could be that they are depressed because they lost their job. Could be they've been battling anxiety because of the pandemic.
Okay, all right, I understand that.
So
what about kids? I'm sorry.
yeah,
I'm sorry.
no, you go ahead.
What about kids?
At the crisis center?
Yeah, do I understand there's like a partial hospitalization?
Yes.
Okay,
So
explain this to me.
So just prior to opening the crisis center, we've been a little busy in case you can't tell.
Yeah.
Just prior to opening the crisis center, we opened our child and adolescent partial hospitalization program.
Okay.
Currently, we're accepting referrals for ages 12 to 17. What the partial hospitalization or PHP program does is there are 6 psychotherapy groups a day, which include recreational therapy, music therapy, a lot of hands-on therapeutic techniques. And we also have a teacher, so the students won't lose their academic. And one of the best things I think we're really priding ourselves on right now is we do provide free transportation for parents who cannot get their children to the program.
Oh, wow.
That's Monday through Friday from 9 o'clock to 2:45.
So let's talk a little bit about the need for that. I mean, for adolescents.
Sure.
Is it a big need?
It's a huge need. If you look at our location, the only traditional services that we have here in our location is outpatient or some intensive outpatients. There's no partial hospitalizations. There's no inpatient currently. You either have to go to Baltimore or Delaware. So like I said, we surveyed the community, we saw the need, and we pounced and took care of it.
I've got a funny feeling we could spend more time on this than we really have to spend on it.
Absolutely.
Is there some place that we can learn more?
Absolutely. If you go to TidalHealth.org, click on the Behavioral Health Services link, it'll show you all of the services that we provide from Tidal Health Peninsula Regional, phone numbers, emails, and referral processes.
Awesome.
A good resource indeed.
Absolutely.
Stacy Walker, thank you so much. Tidal
Thank you.
Health. Thank you for being here.
Of course.